When we're young, the idea of monsters under our beds is the biggest fear we can imagine. But as many of us age, that fear begins to take a different shape. One that we can't fight with our fists. One that's wrapped up in deceptively calm words delivered by a white coat in a sterile room. Dementia. It's this fear that drives many people to keep their heads in the sand, pushing forward with life as normal and ignoring their diagnosis. Dr. Peter Rabins, professor emeritus in the departments of psychiatry and medicine at the Johns Hopkins School of Medicine, says since so many different diseases can cause dementia, it's important to parse out which one is the culprit to get the best treatment, because there is treatment.
Somewhere around 1 or 2% of people who have dementia have a totally treatable disease. For example, low thyroid, very low vitamin B12. There are a number of medical treatable diseases that have dementia as one of their symptoms, particularly if they go on long enough. So having a thorough evaluation is important.
Rabins is the author of Is It Alzheimer's? 101 Answers to Your Most Pressing Questions About Memory Loss and Dementia, 2nd edition. His mission is to inform and empower both patients and caregivers to optimize their quality of life, no matter which state of the disease progression they're dealing with. Which is why Rabins believes it's so important for patients to fully understand their condition, even if they're not part of the small percentage with a curable condition.
When we get a more specific diagnosis, that tells us something about the here and now, what are the problems the person's having, but also what's likely to happen in the future, and also about what might help the person function better and have a better quality of life. I mean, I will say that if you put aside the biological treatments, many of the principles of care are the same, whether it's Alzheimer's or Parkinson's dementia or Lewy body dementia. But having a specific diagnosis can help.
While each disease provides its own challenges, Rabin says the goal is always to maximize the person's quality of life. This looks different as the condition progresses, but big impacts can be made even when someone's in the more advanced stages. Pain, for example, is hard to notice in dementia patients, so being aware of the signs can make a world of difference for these people.
Many people lose the ability to speak or to use language, so they can't say, I'm in pain. Now, they may be crying, or when you touch them, they may cringe. So there are markers that somebody's in pain, but you have to be looking for it in someone who can't tell you it hurts. And of course, if you have a memory problem, even if you can speak, you may not remember that a half an hour ago you were in a lot of pain and for some reason things are better now. So that's a big one. It does appear that even treating depression when people are severely ill, that can help some people. Keeping people maximally functional from a physical therapy point of view seems to be associated with a better quality of life, even in advanced disease.
Learning what triggers someone to be upset can help avoid these unpleasant situations altogether.
And once you get to know somebody, even at the late stage of the disease, you learn what triggers them, or you see that they're starting to get upset, stop doing it, even if it's, quote, to help them. So there are lots of care things like that you can do that also improve quality of life, even at the end of the disease. And we treat sick people somewhat differently than we do, whether it's cancer or heart disease or dementia. But understanding that the person has a disease that affects their thinking, I think is important, because then you start using common sense and trial and error. So if there are problems, how do you solve those? And when you do that, you make life better for everybody.
And though a majority of cases are not curable, Rabin says there are some exciting advancements that have come out in the last few years. The first are blood tests that physicians will be able to use to diagnose patients in addition to the brain scans that are currently used.
That's a huge advance, partly because when doctors could only diagnose by symptoms, we were wrong from 10 to 30% of the time, and whether it was Alzheimer's disease or some other cause of dementia.
Though they are currently made for people with Alzheimer's disease, Rabins believes that the same strategies will soon be able to diagnose other conditions as well. Along with the blood tests, there have been 2 medications approved to treat the disease, but they aren't yet able to make a dramatic difference. Currently, patients taking these drugs see about a 7% improvement. And though it's a modest change, Rabin says for these people and their families, it's a noticeable difference.
It's as if we're at the dawn of a treatment era. I like to think of it compared to cancer treatment. This is like 1960 when we were just starting to have medicines that help people live a little bit longer. So we need to have lots of progress and not better medicines, but probably different kinds of medicine. In other words, medicines that work differently. And, it took a long time to figure out in cancer, well, for many cancers, you need 3 or 4 medicines. And somehow that combination is much better than any one alone. So it may be a combination of these medicines and other new ones that target different aspects of the disease. So it's a start.
While we wait for these breakthroughs in drug development, there are other ways for people to increase their quality of life when living with dementia. The first is getting an early diagnosis. You may be wondering how to tell the difference between dementia and age-related memory issues, but Rabin says it's a much more clear drop-off than most assume. For example, when given a list of words, a healthy young person can remember about 1 extra word than a healthy 70-year-old. Not a huge difference, right?
If you were to give that list to somebody with mild Alzheimer's disease, maybe they'd get 3. So it's a big difference. And sort of related to that, let's say somebody's getting married this coming weekend and I forget about it and I'm reminded. A normal aging person is most likely to remember that. A person with Alzheimer's disease is most likely not to remember it because it's learning new information that gets impaired first. So do you have a doctor's appointment? Are you going out to dinner tonight with somebody? Those are the kinds of things in people with Alzheimer's disease that become impaired. And so it is pretty noticeable.
When looking for the signs of dementia, either in yourself or a loved one, it's important to have a full picture of the risk factors. Unfortunately, the biggest one is something none of us can outrun: age. Still, that doesn't mean that everyone will develop dementia as they get older.
Let's say at age 80, somewhere around 20% of people have dementia. 20, maybe 30. Some people say 30. But so that still means that at age 80, 70 or 80% of people are normal in their thinking. So I think it's important to keep that in mind, that doesn't appear to be inevitable that you'll develop it. The second biggest risk factor is high blood pressure. And what's really important is high blood pressure in midlife. So people who are listening and who are 40, 50, maybe 60, and have high blood pressure, it's really important that you get that treated as well as you can.
Rabin says the connection between high blood pressure and dementia later in life isn't well understood, but the leading theory is that it damages blood vessels in the brain and increases the risk of stroke.
There are a number of other risk factors that aren't anywhere near as powerful, but it seems clear that there's a good correlation between exercising more and being socially more active and having a lower risk of developing Alzheimer's disease. It's really hard to prove cause and effect. Right? You'd have to tell a group of people, don't exercise for the next 20 years, and another group of people, you have to exercise. Forget it. We're never going to do that. But there are many, many studies that show correlations between more exercise, less dementia, more social activity, less dementia. I would say doing crossword puzzles and Sudoku, probably not.
If that statement was a shock, you're not alone. Society has long held puzzle games as the gold standard for staying mentally sharp. And while Rabin agrees that these challenges can be helpful, there's no magic injected into these specific games. In fact, he says the best activity you can do for your brain is simply one that you enjoy doing.
It's much better to find something else mentally stimulating that you enjoy. Reading or being in a discussion group or arguing with people or playing sports or, thinking about what's new in football and different plays and all that. I think it's finding something that people find mentally engaging, whatever that is, and to think that, well, if I just do crossword puzzles or just do Sudoku, that's going to be it. Again, you're probably not going to continue because you have to do this for years if it's going to have a prevention.
And as Rabin's mentioned earlier, consistent physical activity like walking has been shown to be protective against dementia.
I think there's strong agreement that more exercise in general is protective. And then there's some other thing, just for prevention. I think we should say that there's at least a suggestion that if you have hearing impairment, getting that treated might help, especially if you have other risk factors like heart disease, might help prevent dementia. There's something about exercising that affects the brain. Well, in a sense, hearing and comprehending what you're hearing, that's exercising that part of the brain. Same thing with vision. So it's a two-way street between the inside the body affecting what's outside and outside inside.
While many discussions around Alzheimer's and dementia center around the patient, Rabin's book dedicates the last 2 chapters to caregivers. In fact, he argues that every chapter was written with caregivers in mind.
We wrote the first edition of the book in 1981. So that was a time when most people had never heard of Alzheimer's disease, and I include doctors and nurses in that, most people. But more importantly then was that even though we don't have biological treatments, there are lots of things that we can do to make life better, both for the person and whoever's caring for them. And throughout the disease, most people live at home with another person. So we wanted to target caregivers and caregiving because we really believe that if people were informed about what to do and how to do it, they had a better chance of helping the ill person.
This conversation has touched on the importance of increasing the patient's quality of life however possible. And Rabin says the same is true for caregivers. They often are giving so much of themselves that their own needs are neglected.
It's distressing for most people to be a caregiver, not everybody, but for most people. And that means don't shut yourself off from your friends and family and other loved ones. You need to keep active and busy and stimulated, even if you feel like you're the best caregiver for your loved one. And often that's the truth. And don't neglect your health. Make sure that you keep up, your medical appointments and whatever you need to do to keep your own health up. I think it's easy for that to get lost when you're spending a lot of time caring for somebody else. These are some of the things that people can do.
Rabin goes into even more detail in his book, Is It Alzheimer's?, which is available now wherever books are sold. You can find more information about Dr. Peter Rabin and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.